You've been here before. You're here for the cranial nerve exam. Of course. What was your name? Yeah. I remember your face. Can I just get your date of birth? Yeah. Okay, and you are right on time. Perfect. Excellent. I'll just pop this to the side and we'll get started. So, I'm Dr. Shiver. I'm going to be doing your exam today. So how have you been doing? Yeah? Good. We're going to start the exam with an eye test. I have a light here. I'm just going to have a look at your eyes and make sure everything is working as it should. So, I'd like you to look straight ahead. Look at my nose if you need to. Okay. So just look at my nose and try not to look at the light because it can be quite bright. Okay. Good. Keep just looking at my nose. Good. Perfect. Very good. Blink. Good. Okay. Blink again. Excellent. Take another look. Can you just look up here for me? Good. Okay. Good. Keep looking. Very good. Now, look down here. Good. Perfect. Good. Just keep looking down. Good. Look down. Good. Very, very good. Well done. Blink. Good. Blink again. Perfect. I'm going to test your dilation, so what I need you to do is just close your eyes. Just close your eyes down for a moment. Just close your eyes. Just close them. I'm going to count to 3, and when I reach 3, I want you to look straight ahead at my nose, and I'm going to see how your eyes react to the light. Okay. 1, 2, 3. Look straight ahead. Good. And good. Very good. Close your eyes again. So just close your eyes back down. Close them back down. Very, very good. Good, good, good. On the side this time. So on the count of 3, look straight ahead. 1, 2, 3. Good. Perfect. Very, very good. So that seems to be reacting perfectly. Now, stepping back, can you just follow the light? Try to keep your head as still as you can and just follow it with your eyes. Good. Excellent. Just want to see how your eyes can respond to the light as it moves from side to side of your vision. Very good. Perfect. And good. Okay. Now, I'm going to do a peripheral test. Again, lots of staring straight ahead at my nose. Going to move my fingers around you like this. Now I want you to tell me when they disappear from your field of vision, okay? But you need to look straight ahead. Okay, you ready? Good. Good. Perfect. Good. Good. Going to do the same thing in reverse, so when they come back into your field of vision, okay? Yes, blink. Blink again. Very good. You ready? Okay. Good. Very good. 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 Very good. You did a very good job at that. Well done. Just gonna go grab a little thing to do another test with, okay? Rest your eyes. We're gonna do some Ishihara color blindness tests. So we'll just do a few, just to see if there's any changes in your color vision. Okay? Okay. Right. On this page, what number do you see? 29. Very good. And on this page, what do you see? 15. Good. Okay. Can you just take a hand and place it over your eye? Make sure it's the nice soft part of your hand and just place it over your eye. We'll start with your left eye. What number do you see here? 5. Very good. Okay. And this one. 97. Very good. Can you just take your hand and place it over the other eye now? Good. What number do we see on this page here? 8. Perfect. And this one. What number do we see here? 3. Very good. Excellent. Just opening your eyes again. Yep, both uncovered. Can you tell me what number is on this page? You don't see anything? Good. This is what we call a control. So there's nothing here. Very good. You did a very good job. Well done. going to now ask you to close your eyes for some light sensitivity tests. Okay? So the light I'm going to use is very, very bright. So it's important you keep your eyes closed. So just close your eyes. Close your eyes down. Close your eyes. Just close them. Very, very good. I want you to tell me when you see a change in the brightness with your eyes closed, okay? Okay. Good. 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 Perfect. Good. Excellent. Very good. Good. Okay. Tell me, is there movement in the light changing or no movement? There's movement. Good. Now. Good. Excellent. Now. Good. Okay. Yes, there's movement. Now. No movement. Okay, good. Now. Good. And now. Perfect. I'm going to move this light from side to side. I want you to count it for me, okay? I want to start counting now. How many times did you count the light? 5. Very good. Let's do that again. Begin counting now. How many times did you count the light? 11. Very, very good. And we'll just do that one more time, okay? Okay. Begin counting now. How many times did you count the light? 16. Very, very good. You did a very good job at that. Well done. We're going to move on to the hearing test. For this test, I will need you to keep your eyes closed, okay? Okay, so I have some tuning forks, and I want you to just tell me when you can hear it. This is what the tuning fork will sound like. Understand? Okay. Just keep your eyes closed and you just tell me when you can hear it, okay? Okay. can you please tell me when you can no longer hear it? Good, okay. Once more. Good, okay. And again, can you please tell me when you can no longer hear it? Good. So I am just watching the clock to time how long you can hear the frequency for. We're going to move on to introducing a second tuning fork. It will sound like this. So it is significantly higher than the last one. I want you to tell me if you can hear the high tuning fork or the low tuning fork. And again, tell me when you can hear it. Okay? Okay. And again, can you tell me when you can no longer hear it? Good, okay. Good, okay. And again, tell me when you can no longer hear it. Good. 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 Very, very good. So we have both this time. Yes. Good. Excellent. We're going to do something similar to that last tuning fork combination, where I'm going to play either one or two tuning forks. I just want you to tell me if you can hear one or two. The higher tuning fork has been swapped out for one that is relatively similar in frequency. So it sounds like this. So it's a bit closer to the other lower tuning fork. Alright, let's begin. Tell me when you can hear it, and then tell me when you can no longer hear it. And of course, tell me if you can hear 1 or 2. Mm-hmm. Good. 1 or 2? Yes. Just 1. And again, tell me when you can't hear it anymore. Good. Mm-hmm. 2 tuning forks, very good. Mm-hmm. Mm-hmm. Just 1, good. Good. Two. Very, very good. Perfect. You did a very good job at that. Well done. You are welcome to keep your eyes closed for the rest of the cranial nerve exam. You will not need to be able to see for any of the other tests, but if you feel more comfortable, you can keep them open. Whatever you need to do to just stay relaxed. I am now going to whisper words from ear to ear, and I would like you to repeat them back. Okay. Squish. Cake. Cheeky. Perfect. Very good. Buttermilk. Percolator. Yep, very good. Coconut. Experiment. Very, very good. You did a very good job at that. Well done. I have some headphones here. I need to put them on you to play some recordings in your ears. Is that okay? Okay, I can put them on for you if you like. Okay, so just put them on like this. Good. Can you hear me okay? Good. Are you comfortable? Good. So, just glancing down at my computer, I'm going to be playing some sounds. I just want you to tell me what sounds you can hear. just describe them or just say what comes to mind when you hear them, okay? They are everyday sounds. You'll be able to recognize them. Okay. First sound. What sound did you hear? It's water sounds, a river, pouring, anything like that. That's correct. Next sound. What sound did you hear? Keyboard, typing sounds. Very good. What did you hear? Bird song. Yeah. So just birds. That particular one is a tui. Yeah. Last one. What could you hear? Paper, page turning, book sounds. Very, very good. That's correct. You did a very good job. Well done. I want you to now pay attention to your left ear. There's going to be a sentence playing in that ear. And in the right ear will be a series of sounds to try and distract you. So, pay attention to your left ear, and then I will ask you to repeat what you heard. Okay? Okay.
Lots of inferior to you. I told you. You are not of humankind.
Can you repeat the sentence? Very, very good. Now, pay attention to your right ear. Same thing. A sentence will play and then a sound will play in the left ear. Okay? Okay.
Your optimistic eyes seem like paradise to someone like me.
What did you hear? Perfect. Going to do that again. So again, pay attention to your left ear.
I've got good news for you. That gum you like is going to come back in style.
What did you hear? Yeah. Okay. One more time. Pay attention to the right ear.
What is better, to be born good or to overcome your evil nature through great effort?
What did you hear? Yes. Very, very good. That's all of the sentences. I'll now take the headphones. Yeah. How did you feel about that? Good. Okay. I'm going to put on some gloves. Just going to examine your ears with an otoscope, okay? So just having a look inside, making sure everything is nice and healthy, okay? Okay, so we'll start with the right ear, okay? So I'm just going to put the otoscope in and have a look. Okay, so we're looking at any signs of redness, irritation, regulation in colour, any dryness, but everything looks very healthy. Do you clean your own ears or do you keep them professionally cleaned? Okay, and how often are you doing that? Okay, good. It is good to have just a little bit of earwax built up to protect the eardrum. Speaking of, I just want to see if there's any perforation in the eardrum, though based on the hearing tests, I wouldn't expect there to be. Looks nice and healthy. Very, very good. Good. Do you feel any discomfort when I touch you? No? Okay. Yeah. Okay. There. Okay. Yeah. Okay, good. And yeah. Okay. And yeah. Okay, good. Looks nice and healthy. Just have a look at the left. So just popping the otoscope in and having a little look. Again, we're looking for any signs of irritation, which I cannot see any. Earwax level is healthy. The consistency is perfect. You really want a really good consistency that helps catch any debris. It also stays in the ear. Okay. Do you wear earbuds or overhead headphones? Okay, good. Okay. Do you spend a lot of time around loud spaces such as heavy machinery, airborns, concerts, anything of that nature? Okay. And you wear earplugs when you do go to those particular situations? Good. Very, very good. Good. Tell me, does it hurt or do you feel any discomfort when I touch? Yeah. Good. Yeah. Okay. Yeah. Okay. Yeah. Okay, good. Yeah. Okay. Yeah. Okay, good. Yeah. Okay. And yeah. Okay, good. And yeah. Okay, and just taking a good look at that eardrum. Now that looks perfect. Nice and healthy. Very, very good. Good. They both look very healthy. We're going to move on to the last couple of tests. Okay? Okay. Alright. I want to test your sensation perception. Yes, most also the nerves of the skin. I need you to keep your eyes closed for this test, okay? Okay, so I'm going to be touching your face with this fluffy device. It feels like this. Did you feel that? Good. I want you to tell me when you feel the fluffy tip on your skin. Okay. Okay. Good. Perfect. Good. 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 Can you please tell me if you can feel it on the right hand, left hand side of the face, or the right hand side? Left or right? Left, perfect. Left or right? Good, okay. Left or right? Good. Left or right? Good, okay. Now I'm going to alternate between the fluffy side and the more pointed side. It's not very sharp, but we're going to call it sharp for this experience. Would you like me to try it on your skin first? Let me try it on your hand. It's more pointed than sharp, right? So I'm going to be touching your face with either the pointed, sharp side or the soft, fluffy, or dull side. I want you to tell me if you can feel sharp or dull. Okay? Okay, so sharp or dull? Sharp, good, okay. Sharp or dull? Dull, good, okay. Sharp or dull? Sharp, good. Sharp or dull? Dull, very good. Sharp or dull? Sharp, perfect. Sharp or dull? Sharp again, very good. Sharp or dull? Dull, perfect. Sharp or dull? Dull, very, very good. You did a very good job at that. Well done. I just want to touch around your face, just mostly around the eye area and some of the cheekbone, just to make sure that everything feels like it should, okay? I have gloves on, so don't be alarmed when you don't feel skin-to-skin contact. Okay, so just going to touch around the eyes nice and gently. Okay, so just touching around the eyes, up on the brow bone, around the sides, very good. Underneath, just lightly touching, tapping around the temples. press down on the eyes themselves, just applying a little bit of pressure. Good. Just a little bit. Nothing feeling inconsistent here. Okay. Just pressing down the nose. Okay, good. Very good. Good. Okay. That all feels like it should. Did a very good job. Well done. I'm going to test your sense of smell. I have 4 little bottles of fragrance. I'm going to spray them around you. And I want you to tell me what is the most prominent fragrance or smell that you can detect. Okay? Okay, so this is the first one. Deep breath in through the nose. Good. What do you smell? Coffee. Very good. Next one. Deep breath in. Good. What do you smell? Mint. Peppermint. Very good. Next one. Deep breath in. Good. What do you smell? Lemon, citrus. Good. Last one. One more deep breath in. Good. What do you smell? Vanilla. Very, very good. You did a very good job at that. Well done. I'm now going to test your sense of taste. I have little bottles with flavoured essence in them. I want you to tell me the flavour group. So there are 4, and typically there's 5 flavour groups, but it varies. But be 4 of them out of the 5 major groups. So it can either be salty, spicy, sweet, sour, or the sneaky third one, which is umami, but we'll see. Yeah? Okay. Open your mouth for me. What do you taste? Salty, very good. Next one. Okay, opening your mouth. What do you taste? Spicy. Okay, good. Next one. Opening your mouth again. What do you taste? Sour. What do you taste? Sweet. Very, very good. You did a very good job at that. Well done. That concludes your cranial nerve exam. Based on the exam that I've run, you can see that your nervous system and your mind are operating very, very well. Yeah. You are welcome to Romania and have a little rest. I know that your eyes are closed, so you might want to just relax for a while. Yeah. No pressure. We stagger appointments so that patients can have as much time as they need after a cranial nerve exam. Or any kind of exam, really. Yes. Your comfort and relaxation is our highest priority. Yeah. Right, well, it was wonderful working with you today. And you have a wonderful rest of your day.